Welcome to Ali Fitness Podcast, a weekly production all about bringing health into fitness. Dr. Carolyn Coker Ross is an author, speaker, expert in using integrative medicine for the treatment of eating disorders, compulsive overeating, binge eating, and addictions. She is a board certified in preventive medicine and addiction medicine and is a graduate of Andrew Wales Fellowship in Integrated Medicine. She's the author of 3 books. The latest is The Food Addiction Recovery Workbook. Dr. Ross is the CEO of the Anchor program, which I'd like to talk about, an online coaching program for overeating and binge eating disorders. Very privileged to have you on the show, Dr. Carolyn. Thank you for coming.
Thank you so much for having me.
There's so many things that I want to address with you as we were speaking offline. So I guess the first question is, how did you become addiction therapist and then also an integrated health doctor?
Well, I think a lot of it has to do with my own family history, which I do have a family history of addictions. So that certainly piqued my interest in going into this field and my desire to learn more about it. In terms of the integrative medicine, I, for some reason, have always been interested in using complementary and alternative therapies. I think mainly because so much of what we do in traditional Western medicine doesn't always work, particularly for the things we're talking about today. So, for example, for people who are struggling with food or body image issues, or people who are struggling with addictions. For most of my career, we haven't had any real effective means of treating those conditions. And that goes for a lot of other things too. And so I found that the use of integrative therapies, including complementary and alternative therapies, really added a lot to my ability to help my patients heal.
And you mentioned a family history. Did you personally have an issue with some sort of addiction?
No, not myself personally, but other members of my family, both of my brothers, one who died about a year ago, who had a very severe heroin addiction. You know, he suffered with that through most of his adult life up into his late 40s when he actually got really ill and they found out he had chronic renal failure as a result of his heroin addiction and his untreated high blood pressure. And that led to the beginning of his being in recovery and reestablishing relationships within the family and so on. And one of my other brothers also suffers with addiction.
And I guess just for our listeners and for me, can you define the word addiction? And I guess also on top of that, aren't we all addicted to something?
You took the words right out of my mouth. That's what I say. We're all addicted to something. So for me, addiction, I look at it as at its essence. And at its essence, addiction is where we are usually unconsciously giving over power of our lives to a substance or a behavior, or even sometimes to certain beliefs or thought patterns. So you can look at everything from the process addictions, which are an addiction to behaviors. And those include the eating disorders, anorexia, bulimia, binge eating disorder, etc. And then gambling is considered a process addiction. Sex addiction could be categorized there. And also now the World Health Organization has included gaming addiction as part of the process addictions. So you can look at gaming addiction, addiction to your phone, addiction to social media. All of those are process type addictions because it's an addiction to a behavior. And then on the other side are addictions to substances, drugs and alcohol. We don't often think about how certain thought patterns or certain beliefs that we have, usually from childhood, that we can become addicted to those and they can color all areas of our lives and cause us to give over our power. So I think when Alcoholics Anonymous talks about powerlessness, I think of it as given over power to a substance or a process or a behavior.
And so how do you even start dealing with an addiction? How do you know that it's bad enough to deal with?
That's a great question. And the answer to that is really that whenever you give your power over to something or someone, I didn't even mention what we call love addiction, where you give your power over to, someone you care about or someone you love. But whenever you give your power away, it begins slowly but surely to take over your life. So it affects all aspects of your life. It can cause unwanted consequences. You may find yourself unable to stop the behavior or stop using the substance. And as a result of that, your life starts to fall apart. You lose relationships. You may lose jobs. You lose your health. And there are many aspects of it that are part of the definition of addictions. But it's really how that behavior, that substance, that, addiction takes over your life and you're powerless to change it.
So essentially, when you lose control of other parts of your life?
Yeah, I don't want to say control, because actually being in control is considered part of the addictive process, your need to try to control something. We see this a lot in anorexia and some of the other eating disorders. So it's really not control. A better word may be agency, or where you're no longer in charge of your life. You can think of the visual of you're in the back seat of a car and you're trying to drive the car, and your addiction is in the front seat. You have no agency. You don't have access to the brake pedals or the accelerator or the steering wheel, and yet you think you're driving the car.
That's a great analogy. I guess my biggest question is then, you've easily defined addiction, but obviously there's lots of addictions and you deal with all sorts of things from opioids to alcohol to food addictions. Mm-hmm. Is there a common theme that you see amongst all of these addictions?
Yes, absolutely. There is a common thing. And maybe we can talk about this later, but there's some clarification we need to have about the term food addiction. But let me talk about the central defining commonalities between all addictions. We know that now that studies are supporting that addictions have their roots in trauma. And in the past, people would say, I don't have any trauma. I've never been abused. Nobody's ever beaten me or anything like that. But the newer studies are really pointing to that trauma is a large spectrum that can include everything from having a parent with an eating disorder or an addiction or depression, having someone in your family who's been incarcerated, a whole long list of situations that lead to a loss of a sense of safety or security in your life, or a loss of a sense of peace, a loss of an essential part of who you are. And that's what is now considered trauma. So we know that while not all people who've been traumatized become addicts or develop an eating disorder, we do know that all addicts have, at some point in their lives, and I would say the same for eating disorders, at some point in their lives have experienced some traumatic experience, usually as a child.
But your definition of trauma there is so broad that I feel like every person that's lived beyond the age of perhaps 10 has had that some sort of trauma.
Good point. But what we really focus on is whether or not that trauma occurred before the age of 18, and particularly if it occurs when you're a child. And the reason for that is because then it actually has physical ramifications. It changes the way the brain is wired, changes the hard wiring of the brain. And that makes it more difficult to overcome, because children, as you know, don't have the skills to cope with traumatic experiences. And it could be something like an earthquake, or I saw back in the day a lot of patients from the Hurricane Katrina. So as a child, you may not have had those skills to cope with that. Whereas if that happened to you now, it may be difficult, but certainly not impossible for you to cope. And so it's really trauma that affects you when you're a child, or at least under the age of 18, that we're studying now.
It's interesting, but I do also feel that every person under the age of 18 has had some sort of trauma in their life.
I don't think it's really true that everyone has had some trauma. There are an increasing number of people in the U.S. in particular who have had trauma because our lives are so busy. Parents are often not with their children, and there's just so much chaos and stress in life. But there are many children who grow up in intact families whose parents didn't abuse them, who didn't have a member of their family who was incarcerated, et cetera, et cetera. So, I mean, there still are people like that. But, if you think about it, there's an increasing number of people who are addicted to drugs and alcohol and also who are developing eating disorders. So that parallels what you're saying, that, there are more people nowadays who are having traumatic experiences than they were maybe in the 1950s, for example.
And do you think also that it depends on the person's character? So say, for example, one child experiences an earthquake and that trauma then leads to some sort of addiction, whereas another child who has the exact same experience, for whatever reason, it just doesn't affect them the same way. Is that also a possibility?
Yes, there are innate characteristics that we have that help bulletproof us from trauma, and those are things like resiliency. But also there's a factor of how much social support you have. So if you're a child and you have, close relationships in your family and you go through an earthquake and your family comforts you and explains things to you, et cetera, then that's less likely to threaten your sense of safety or security or your sense of peace. But say, for example, you're going through what many of the immigrant children are going through, where you're separated from your parents when you're a child and nobody is telling you why because it happened so fast. There's no family around. That's going to be very traumatic for those children. For most of them anyway, that will be very traumatic. So I think there are some inner characteristics that we have, like being resilient. And then there's the factor of the outer characteristics in our environment, which include things like social support, family support, et cetera.
So in terms of studies, is there a direct correlation with, say, children that don't have a good family support growing up that then would get some sort of addiction?
Well, there is a direct correlation between the number of adverse childhood experiences you've had in your life and later risk for addictions, eating disorders, weight issues, and medical problems. It also actually can be correlated with loss of years of life. So you may, even up to 20 years of life, die earlier than someone who didn't have that high number of adverse childhood experience. And we do know that social support at all ages is a mitigating factor against all of that.
Interesting. So, Dr. Ross, I know you run a very successful online program, the Anchor program, and you deal with people who have all sorts of addictions. Does that Anchor program specialize in any particular addiction? And how do you, I guess you can't tell us all your secrets, but how would you even go about, I guess, having and I'm assuming it's not a one-size-fits-all approach, but how would you go about having an online program for something like this?
Yes, well, the Anchor program at this point mainly focuses on people with food and body image issues. So that could be, anyone who is struggling with binge eating or emotional eating or, all of the above, and also has some issue with their body. And that could be, I don't like my size, I don't like certain parts of my body, I'm just dissatisfied with my body. So the Anchor program really, it offers a 5-level approach. And I can tell your listeners that I have a little 5-page ebook that's free if they want to learn more about this. But the 5 levels are starting to treat people on first the superficial level, which is like the tip of the iceberg. If you imagine an iceberg, you see the ice above the water, and that's what gets everyone's attention. And those are the behaviors that you're engaging in, whether it be using drugs or alcohol or, overeating or binging, et cetera, or restricting as an anorexic. So until we really address those superficial behaviors, it's difficult to get a person's attention away from the behaviors so that they can do the deeper work. And the deeper work includes really identifying what I call the emotional soup, which are the emotions that tend to drive your behaviors. And those emotions are linked very, very closely to what are called core beliefs that develop in childhood and usually are the result of some type of childhood experience or childhood trauma. So you have something happen to you, and then you have the belief, I'm not worthy, I'm not lovable, all of those kind of beliefs that can result from negative experiences in childhood. And then the fourth level has to do with really grounding yourself in the body, because first of all, if you have a history of trauma, trauma lives in the body. It's held in the body. So we need to be in the body in order to heal it. And also the body is a reservoir for all the wisdom that you need that will guide you through your own personal journey to healing. So when we cut ourselves off from the body, as we do with compulsive overexercise or binge eating or fill in the blank, drugs and alcohol, then we are losing that really incredible intuitive resource that will help us get out of the problem. And then the final level of healing through the Anchor program is healing at what I call the soul satisfaction level. So I ask my patients, if you were to live to satisfy your soul, not the scale, for example, not your parents, not your spouse, if you were to live to satisfy your own soul, what would you do differently? So this is really about tapping into kind of the essence of who you are, your own true, authentic self, and allowing your authentic self then to determine what your beliefs are, what your behaviors will be, etc. So those are the levels that people need to go through really in order to recover fully from any of the problems we're talking about. And it's not a linear process. It's not like, oh, I finished this one, now I go, because people go back and forth. You may have relapses on your behaviors. Then you go back to that level and work on the behaviors and then come back and work on emotions or core beliefs. So I hope that was clear.
So in your experience, and I guess it totally depends on the person, but how long can this process take? And just speaking from maybe some experience of clients you've worked with.
Well, it varies depending on the addiction. As you know, drug and alcohol addiction can be very, very difficult to treat, high risk of relapse and so on. But now that we have medication-assisted treatment for opiate addiction, for example, people can reach stability pretty quickly and then gives you the opportunity to get rid of those behaviors so that you can start that journey. For eating disorders, it can be a longer period of time depending on where you are in your journey. Some people are still believing that if they just looked a certain way or they were size 2 or, something would change about their body, then everything would work out. But if you have that belief, it's difficult to break it because it's something that the culture supports. And so we have to go through all of the different layers based on where the person is in their own life and in their own journey.
Interesting. You've been talking about beliefs a lot. Do you think changing one's belief would be the only way to get rid of an addiction?
Can you give me an example of what you're meaning?
So someone's got a belief, say from childhood, that they are always going to be fat because that's what happens in their family. If they don't change that belief, is it possible that they can change their suffering with bulimia?
I'm not speaking about beliefs like that. I'm speaking about the belief that's under what you're saying. So if someone says, I'm going to be fat from childhood, I ask them, what is the feeling that you have when you think about the inevitability of you being fat? How does that make you feel? And then we get below the feeling. So it may make them feel fearful or, sad or whatever. And then you ask yourself, what do you say it means about you that it's inevitable that you're going to be fat and that this is going to happen and you have no control over the situation and that it's going to make you sad? And for many people, they might say things like, well, that I'm unlovable. And that's the core belief. I'm unlovable. So no, you don't have to change it immediately. As a matter of fact, these core beliefs are usually unconscious. They're not something a person is aware of. So in the beginning, we start with addressing the behaviors and the emotions, etc. And then we gradually work towards identifying the true core belief, because a core belief is almost universal. It affects multiple areas of your life. Like if you say, no one will love me if I'm fat, that's going to affect your relationships, your job, your friendships, and many areas of your life. That's how universal it can be. So that's the kind of core belief that I'm referring to.
Interesting. And you mentioned earlier a point that you wanted to come back to about food addiction.
Yes, I do want to clarify that because I know many people listening identify themselves as having a food addiction, or they may jokingly say, I'm addicted to chocolate and so on. So food addiction is really an eating addiction. It's not the food that's the problem. It's the same underlying characteristics or underlying causes. The root cause often has its basis in some kind of trauma. And it's how we're using the food that makes it, quote unquote, addictive. So if you're using food to soothe or numb your feelings, obviously the food industry is going to put salts and sugar and fat in foods because that's what makes it highly palatable or more tasty, as we say. But it isn't the food that's addictive. It really is how you're using the food and how it becomes a coping strategy for you. And that's what we need to address, not removing the food. I really don't have the belief that you can always deprive yourself of chocolate or sugar or fill in the blank. It's really almost impossible in our culture unless you're always eating at home and always in control of what you eat. But even then, we all have cravings and urges to eat certain foods. So I think it's important to, again, address the underlying cause rather than just to focus on demonizing the food.
That's a really, really good point. So it seems like you've moved your career from practice-based, working from a clinic in all sorts of addictions, and I could be wrong, so please correct me, but now you've moved sort of towards running this anchor program that really addresses food addiction. Is there a reason for that? Have you seen a need in this area?
What I've moved from is, as you said, from an office-based practice to an online practice. And I still work with eating disorders and addictions, but I do it now online, either online video or phone, so via telemedicine. The reason that I made that choice is because I feel, I've worked in some of the most famous treatment rehab facilities in the country. And what has been disappointing to me is that people will spend $50,000, $65,000 for 30 days of treatment, and then they come home and they relapse because there's no support there or not enough support there. So my feeling is that by offering a virtual program, I have the ability to help people deal with what is, and we know is, a chronic long-term problem over a longer period of time. In my practice, I was able to, run a group, the Anchor program, in-person group for 5 years with mostly the same people. And that was really powerful because then I got to see all of the different stages that people went through on their journey to healing with any kind of eating or body image issue. But, the current system doesn't usually allow people to have that kind of long-term relationship. So that's why I developed the Anchor program, is so that I could work with people over a longer period of time. Because we've been told over and over that addictions are a chronic brain disease. So we need to really start treating it that way.
That's interesting. And so what percentage do you know of any studies, or just in maybe your experience, of people that go away for 30 days to a facility and sort of get on top of, well, what seems like getting on top of an addiction and then that relapse?
Well, we know that overall for substance use disorders, I think the study says 80 to 90% relapse within the first year after treatment. And I don't know if that's across the board for all kinds of treatments or whatever. I do know that the rate of relapse is extremely high from both addictions and eating disorders. I feel like 30 days, if you really accept the premise that trauma is at the root cause of addictions, it's almost impossible to treat trauma of any kind in a 30-day program. And so then someone comes out and they leave this highly structured environment where they have therapy sessions every day and they are in groups and they have all of these buddies to support them. And then they go back home, either living with themselves or living with the family who may not be really understanding or educated about addictions. So how is that ever going to work? I just don't get it. So many treatment centers are now promoting aftercare and setting up facilities around the country to help serve that need. But there's still a need, like in rural areas, in amongst certain populations, such as Native Americans, African Americans, Hispanics. So I think the only thing that I've come up with as a realistic approach is to tag team with these other approaches and offer this online version, which people can come in and out of for years and years until they're ready to, make it on their own.
I like that approach. It's like, I guess, if I was to draw an analogy, people go on a diet and then after the diet, they just go back to their normal habits.
Right.
I love that approach. It sounds very and common sense, but I guess common sense isn't so common. In terms of your demographics, if you were to sort of narrow down your typical client, would there be a particular age group or sex that you seem to be, I guess, working with mostly?
I end up working mostly with women, although I love working with men. I think men are still reluctant to seek help, and they aren't as stigmatized as women are up until recently, which I think the stigma for men who are living in larger bodies is increasing. So we may see them approaching treatment more often. But I end up working with women. Many of them have been dieting for their whole lives, or they've had an eating disorder since they were 13. Most of the ones who I do well with are people who are starting to realize that there's something that's missing. So they may have been in treatment, they may have been on, as I said, multiple diets, and they finally get it, like, wait a minute, this isn't working. My life isn't going to be perfect just because I lose weight. And it's really the reverse. It's really working on your life first. If you choose to change your weight, then it should come after you're in that different mindset of, losing weight isn't going to fix my life.
And what percentage of people do you think then choose that losing weight option?
In my experience, it's variable. I would say that most of the people I've worked with lose, some weight, anywhere from 5 to 15% of weight. And my goal is to help them maintain whatever they lose. And frankly, there's a lot of more important things in the world than trying to get to be thin. Some people find out that they've been putting off many things that they really, truly want to do or love, like, dating or finding a different job or training for a different career. So for many people, they choose to go on with their lives as they're working on whatever they want to do with their bodies. And I think that's reasonable. I mean, just think about how many women who spend 50% of their energy just trying to stay thin or get thin.
Well, when you said your description of who you help, and I was thinking that that's probably 99% of the population that have an issue with the way they look or something they're not happy about. So, yeah, I dare say that.
But not 99% really are willing to get help or to do the work it takes to change.
Absolutely. And I think, like you said too, once they do that work, they love themselves enough to actually just sort of accept themselves.
Just be. Yeah. But you do find that when you love yourself and you take better care of yourself, you will settle at whatever the weight is that's appropriate for you. And I think that's as it should be. Sadly, so many people have, wrecked their metabolism through these crazy diets, these fad diets. And I'd love to see children, not have to go through that, because that's kind of the beginning of the end when they're put on their first diet.
Yeah, absolutely. So I guess my big question, Dr. Ross, is what should people do if they feel like they're going through something like we've mentioned, or perhaps even more so, a loved one's going through it? How do they deal with that in terms of trying to help them?
If you're talking about a concern for a loved one, the only thing you can do for a loved one is to express your concern and to express it in a healthy and kind way. And that would be something along the lines of anorexia, for example. I've noticed that you've become thinner, and I've noticed that you're not eating regularly, and I'm concerned about that. So you can express your concerns for them and offer help. So I'm really here for you. I'm willing to help you if you need help. And that's about all you can do, unless they're your children and they're under the age of 18. In terms of for yourself, if you feel like you're ready to get help, then I encourage you to, number one, recognize that this is going to be a chronic problem. It's not a 30-day fix or a 60-day fix. So whatever you choose, whether it's coming into the Anchor program or finding a program on your own, look for something that's going to offer you a long-term approach that is not focused on dieting. And for addictions, that is the hardest thing of all, is to find treatment centers that you can trust and rely on. So if anyone wants to know about treatment centers that I would, suggest for them, I'm happy to respond to any email questions on that. I believe there are some websites, including the SAMHSA website, the Substance Abuse Mental Health something, but it's SAMHSA. So the SAMHSA website, I believe, also has a list of treatment centers that they feel are doing a good job.
Excellent. Thanks for sharing those. And we'll definitely put those in the show notes, as well as your website. I'm assuming you can get your ebook off your website, can you?
No, the ebook is available through my Facebook page, and I can give you that and you can put it in the show notes. But yeah, the ebook is available that way. You can download a free meditation on my website and also do a free quiz to determine if you do have an eating problem.
Excellent. Look, Dr. Ross, thank you very much. And just before I let you go, there's a little question that we ask all our guests on the show, slightly different to eating disorders, but do you have a tattoo?
I do.
Share.
You want to know what it is?
Is it a big, cake or something like that?
No, it's not. No, it's a hummingbird on my ankle, and it actually is something that reminds me of my son, who passed away as a result of his mental illness, and the hummingbird is something that reminds me of him. That's the short story.
And so can I just ask a quick question on that? Why a hummingbird, or is that going to be a long story?
It's a bit of a long story, but I can shorten it to say that after he passed, I was living in Arizona, and every morning I would go out for a walk and I would see hummingbirds on the path, and I felt his presence when I was there with the hummingbirds. So that may be a little woo-woo for some people, but it's just something that helped me to get through a really tough time.
That's awesome. Thank you so much for sharing that and all the other knowledge that you passed on to us. I love what you're doing. It's really great that you could share that with us. I'm sure a lot of our listeners will be in touch. So thank you so much.
Thank you so much for having me. It was a pleasure to be on your podcast.
For all the resources and show notes from today's episode, please go to www.ally.fitness. If you liked today's episode, please show your appreciation by going to iTunes, give us a 5-star review and subscribe.